Hello, thank you so much for your interest in learning more about the Dietetic Internship program here at the University of Kansas Medical Center. My name is Dr. Jeannine Goetz, and I'm the program director here at KU Medical Center, and I'm excited to share a little bit about our program with you. Please know that if you have any questions as I'm talking, please make note, and I'm happy to meet with you, have a Zoom session, a call, to be able to answer those questions for you. So if you haven't been to Kansas City before, it's a great place to work, to go to school, to live. There's so much variety in entertainment, culture, lots of great food. So the Med Center is located right near the heart of the downtown Kansas City area. And you see that our beautiful skyline there in the picture. And so the Med Center is located about 5 minutes from there and right on the Missouri-Kansas border. But as you can guess by our name, we are located on the Kansas side of the border. So oftentimes students will ask me, what's something that you think sets you apart from other programs? And one thing is that we are uniquely situated within an academic medical center. And so one thing that this brings is the opportunity to really engage in interprofessional collaboration. And that's something that our students really get all along the way when they're in our program. So the dietetics department is located within the School of Health Professions. We're one of the largest in the nation with over 25 different academic programs within our school. And then we also have a School of Nursing and a School of Medicine. And so we really have the opportunity to engage with other health professionals. So back in the day, oftentimes dietitians worked in their own little silo and treated and took care of their patients. But we know today that really in order to provide optimal care, we really need to collaborate and work with other professions and be able to integrate our care together. And so that's something that you will learn here at KU Medical Center. So I'll talk more in a minute, but we have other teaching clinics that our students are involved in that are interdisciplinary. We have a JDoc, which is a safety net clinic where we practice these skills. We have all campus activities that are learning about interprofessional collaboration. So this is one thing that you will definitely get here at the Med Center. Okay, to give you a high-level overview of our program, we do have an emphasis area in medical nutrition therapy, but overall, I would say we just have a well-rounded program, and we also have the ability to really tailor our rotations to your interest, and I'm going to be sharing more about that here in coming slides. Our students come to us in August, and so about a week before classes start, we have orientation, and the whole goal here is to get you ready and prepared for those rotations, to get started with class and to get so that that your other peers in your internship program, the faculty. We do additional training. We hit the ground running and have you do a baseline measure of where you stand in terms of preparing for the RD exam, and then we do reflection and we build on that all year. Students all meet with me, making sure that I clearly know what your interests are and what you're hoping to get out of the program. And then you stay with us then for fall, spring, and summer semester to complete the internship program. And during that time, you're doing now currently it's 1,000 hours of supervised practice experience. Ours is a little bit higher than that, but along with that, 24 hours of graduate coursework. And all of this, we're working to prepare you for that RD exam. So whereas some programs you just wait and you start studying at the end, we're going to do that all throughout the program, so that with just a little bit of concentrated study, once you get done, then you're going to be ready to go. You're going to feel confident going into that exam. And so for those of you that might be looking a little bit further out, today as I'm talking about those who are applying for the 2022 spring match. We will become a combined DIMS program starting in spring cycle 2023. So please stay tuned, and I will be providing further updates on that after this match cycle this year. So we do have 4 primary rotations. So either fall or spring semesters, our students are completing a full semester or 16 weeks of clinical nutrition. So they are assigned to one hospital, typically rotating every week or two to a new specialty area with a new preceptor. So you get really great hands-on individual experience and feedback during this time. This ultimately culminates with the last 2 weeks of you serving as the RD during staff relief. And so you do this one semester, and then the opposite semester you're going to spend half of your time in community nutrition and the other half in food and nutrition management. And then we wrap up the whole internship with a practice area of interest. And this is something that you get to take the lead in designing. It's an area that you really want to learn more about, or perhaps you haven't found yet what you want to do and need to see a couple different areas. There's lots that can be done during that rotation, and I'll share more here in a minute. One of the features that our students often talk about is one of their favorite features is that I allow you to rank where you would like to go for these specific rotations. So I tell you, that semester which of the rotations you will be doing, and then I give a list of all of the different options that are available, and you rank those for me. And then I kind of do a match process, and I do everything I can to try and give top choices. And when I can't, then I try the next time to be fair and be able to do that. I really, if I know someone has a strong interest in something, I'm going to make sure that I do everything I can to make that happen. And so while everyone will be fulfilling the competencies and they're all doing projects within these rotations, you can do them in an area that is more of interest to you. So we do have over, roughly about 50 different sites within the Kansas City area. The majority are here in the general metropolitan Kansas City area. They extend out probably as far, the furthest is Lawrence and Topeka, but I would never put someone there that doesn't rank to go to those locations. And then I'm always looking for additional sites that students might have recommendations for. So if I can get an affiliation agreement and we have a qualified person to be able to work with you, I'm happy to look into additional options as well. So this slide just kind of gives you an idea of some of the practice sites that we currently use. So on the left side of the slide, you see these are our clinical facilities. So half of our students generally go here to KU Health Systems. Very large teaching hospital. Our students have an absolutely amazing experience, really getting exposed to many different things that, at a smaller community hospital, you're not going to get exposure. So for those students that are really passionate about, clinical nutrition, and that's where they see themselves going, this is a fabulous place for them to really get some good experience and to gain that confidence and efficiency that they're going to want when they go out into the profession. We do have a special opportunity that we are able to place some of our students that have a pediatric interest at Children's Mercy Hospital, and they're still getting exposed to all of the different conditions that more in the general hospitals, but are really having that pediatric focus. We also place students at the VA hospital. We have several locations with St. Luke's. So St. Luke's on the Plaza, again, a very large teaching hospital, and then 2 that are a little bit smaller, maybe for someone who knows that they need to have, obviously, that clinical experience for the RD exam and to give them that good foundation, but maybe that's not where they see themselves practicing in the future. So we also have those 2 smaller hospitals, St. Luke's East and St. Luke's South at the moment. And then we also have University Health, which is formerly Truman Medical Center. And then we have a whole bunch of options for our community and management options. So typically management is done either in a hospital setting or within a school district. And we have a number of different options all over the metropolitan area so that hopefully there is a location that is close to you. And then community is where we likely have the biggest variety of options that are available. So you see here things like KU Athletics, KU Weight Management, Hy-Vee grocery stores, Harvesters, Food Equality Initiative. That's a prescription food bank. We have a couple other food bank options. Haskell Indian Center. We have a couple eating disorder locations here in Kansas City. We have your traditional places like WIC. And some other more outpatient counseling. We have the Cray Diabetes Center here at KU Medical Center, KC Healthy Kids. So just a variety of different, we have some with mental health, Johnson County Mental Health and Rediscovering You. Lots of different options for you to be able to tailor towards your interest. Again, everyone is completing similar projects at their facilities that they are going to. We're still achieving the same competencies, but able to tailor that to your interest. And then that last rotation, that practice area of interest, you can see here, there's a number of different areas that you could go into. Oftentimes at this point, our students do kind of know what direction they see themselves going. They're wanting to get more experience in that area. They're wanting to gain confidence and efficiency and really feel like they are ready to go into that entry level in that area. But also sometimes, maybe if you want to do community, but you're not sure yet which area of community, maybe you want to go and work in a couple different areas. So this has a lot of flexibility. Again, you're going to take the lead. I work with you. I help make connections and help with setting this up. But this is really your area. So we have achieved all of the competencies either in the prior rotations or through classwork. So you really get to focus here on what your goals are for the learning opportunity. And importantly, this can be done anywhere. So some of our students do stay in the Kansas City area, but others decide to go someplace else. And maybe they're wanting to go as an example of how you can kind of tailor the program towards your interests. So we don't necessarily have a sports nutrition focus here at the Med Center, but someone could go to KU Athletics during the community rotation and then maybe go back to their undergraduate athletic department for the practice area of interest and get that additional experience. And so ultimately accumulating almost as many hours as you would in our emphasis area, which is clinical nutrition. So lots of flexibility and opportunity here as well. So what does a typical week look like for our dietetic interns? So Mondays, you're here with us on class all day, so basically 9 to 5. There's some little breaks in there. And then Tuesday through Friday out at your supervised practice experience. And those hours are set by your preceptors. So typically your normal kind of work day, 8 to 5 or something, but it can vary by site. And it can also vary, for instance, in your clinical rotation as you're rotating to different preceptors. It can slightly vary as you switch to each of those preceptors. Typically though, it's done within that Tuesday through Friday. Sometimes there might be a weekend experience that you're assisting with. And then during the summer, we have a much more flexible schedule, and that is because you can do this rotation outside of the Kansas City area. So we don't have in-person classes during the summer. You're just doing a practicum course with me that is online. And so you get to work with your preceptor to set this up. So if you're wanting to move through the program very quickly and get finished, you can do 40-hour work weeks, or if it's not as important to you to get done as quickly, maybe you want to take Fridays off and just do 4 days a week or do fewer hours each day. That's totally up to you how you would like to do that. So the only thing that is required in person during the summer is that you come back and you take the final examination to get you finished with the program. So let's look at the curriculum that you would be taking during the dietetic internship program. So I failed to mention earlier, if you stay with us for 2 additional semesters, you can finish up your master's program. And so 14 of the hours that you take of those 24 hours are going to be part of the master's program. The other 10 are practicum hours, and those are related to your supervised practice experience. And so unfortunately those don't count, but you have accrued basically half of a master's program, and the majority of our students do stay with us for those final 2 semesters during the second year to finish with a master's degree. And important to note, if you're watching for applying down the way, in 2023 we will move to a combined program. So fall and spring semesters, you complete a medical nutrition therapy course. This is going to take what you learned in undergraduate, it's going to bring it up a level. It's really going to help with those clinical rotations. Dr. Gibbs does a flipped classroom approach, so you're really doing homework. You're trying to understand this information. She provides a lecture that you watch before coming to class so that you're ready to apply that information. And so then when you come to class, doing a case study and applying that knowledge that you have learned. We try to incorporate simulations, and I'll talk about that more here in a minute. We also have a management class each semester. So in the fall semester, that's more didactic work that's preparing you for that RD exam. And then we're taking all of that and we're applying it in the second semester. So historically what we've done is designing a cafe from ground up as part of a group, and kind of doing a Shark Tank. So who can pitch the best business proposal. And so we're applying all that we've learned about, budgeting and human resources and marketing and layout and design and your menu and sustainability and all of these important concepts. Then you have seminar, and so the purpose of this is twofold. So one, to help you with public speaking skills, and then also to really help you to understand research articles. So really to break down a research article and not just skip through pieces that we're not as clear on, but to really understand and to learn to look for bias and things of this nature. So the first semester we take one research article, we really break that down, we present, and then the second semester we take that up and we look at 3 different research articles, synthesize the findings across that, and present that as well. Then there's 2 online courses. So in the fall semester, International Nutrition, and in spring semester, U.S. Public Health Nutrition. And then there's Practicum, which is taken with me. And this course is kind of the catch-all course. So for instance, if I'm not able to fulfill a competency in one of the other classes or through a rotation, then we're going to do a project together in Practicum course to be able to fulfill those remaining competencies. I bring in speakers, we meet and talk about different things. This is where we are taking practice quizzes all along the way so that we are preparing you for that RD exam. We use Visual Veggies software to simulate the RD exam, and really just trying to help gain that knowledge and the practice of taking those practice questions. We have a whole library of materials that you can check out and use in preparing for the RD exam. We have during that course also Blackboard discussion forums to talk about your different rotations, because everybody is in different rotations. They're having very different experiences, again, fulfilling the same competencies. And so learning from one another about what other opportunities are out there. This also helps with ranking for future semesters when you're thinking about where you would like to go. And then in the summer semester, it's just wrapping up with the final 2 hours of practicum with me that's online. And then if you're wanting to stay with us for that second year for the master's program, then you can take those perhaps another additional master's course during that semester. So again, across the program for the internship, you'll be completing those 24 hours of credit. Now, I mentioned early on about interprofessional collaboration, and that's something that really I feel like we excel here at KU Medical Center. So we have team steps where we're learning about what do all of the other health professions do, how can what we do relate to what that they do, and how can we work together, and how can we best communicate with one another. So this is an event that is put on for all of the students on our campus. And then, as I mentioned, we have interprofessional teaching clinics. So we have one that is in family medicine, and then also one that is a geriatric clinic. So getting to see some different populations there. But you go in, you will have access to the EMR beforehand so that you can review the patient that's coming in and determine what you would like to address. So when you come in, you're paired with other professions, and you all go in and do an interview and find out more information about the patient, come back out, determine how that you all want to intervene, and then go in and provide that intervention, and then come back out and debrief, and you talk about how did we do providing care for this patient, what could we have done better, and so we do this in these teaching clinics. So it's a low stakes way of really getting to work with other professions, also working on your counseling and your education skills. And same thing with JDoc. So JDoc is a safety clinic that we work on diabetes night. These are people that otherwise might not get care. And so really have some very need to get just basic diabetes understanding of the education, and we play such a critical role during those evenings, and thankfully get to sometimes see people and follow up. So there's other professions that are working that day, maybe not as targeted as interprofessional as those other teaching clinics that I mentioned, but this is another great way that we are able to get you to work on your counseling skills in kind of that low stakes time. And then we also have interprofessional collaboration that occurs in some of our assignments during the coursework that you do throughout the year. You will also be exposed to integrative nutrition. So we provide a couple different workshops throughout the year. So really looking at and understanding how that we can provide, look at the root cause of why someone is maybe having some issues, doing a very comprehensive assessment. And so we learn about that. For our students that have an interest in really getting more training in this, we do offer during that summer practice area of interest, we have two, you can apply for a demo award, and with that comes a little bit of a stipend, but also I help to design that practice area of interest, putting you out in the community with dietitians that are practicing more with that integrative lens or functional nutrition lens. And also many of those people have established their own private practice and learning more about how to do that if that's something of interest. And then during year two, if you're interested, we also have an integrative medicine, dietetics and integrative medicine certificate program that many of our students will do. That is at 12 hours. It's completely online, so four courses that you take that lead to a certificate program. So many of our students will come in and not only get a certificate for the internship, complete the master's, and also the integrative medicine certificate as well. I mentioned simulations, and you see at the bottom of this screen, this is our new state-of-the-art health education building. This is where the majority of your courses, your classes will be held, but the top several floors are all simulation space, and it's just absolutely incredible. So we start out, the first week in orientation, and we have several clinic rooms that we use there. If you haven't been into a clinic room or what kind of looks like a hospital room, and you're curious about when I walk in, what do I do? Well, we try and make you feel comfortable and kind of have a little bit of an understanding how that you would go in, what you do when you enter the room, how you introduce yourself to the patient and get that encounter going. So we practice that. We will use live patient actors to simulate NFPE, to work on that and to do assessment, and that allows us to be able to provide really good feedback to you so that you have that as you're going out into your rotations. And we have a final kind of assessment that we use. So there's high fidelity mannequins. We have a command center where we can see and talk through the mannequins and their scripting, so really being able to not stand over you and provide that feedback, see what you're doing. So really wonderful facilities, and we're always looking for ways that we can use this more. This next year we'll also be using some of this to be able to practice placing tube feeding, and we'll do hands-on work with doing blood pressures and taking finger sticks and circumferences and all of these basic skills that we should have as dietitians. We do typically during orientation, we have you do body composition training. So we have really experts in body composition, and they have lots of great equipment that we get you exposed to. So you get to learn about a bod pod and a pea pod and a DEXA. Everybody works on those circumferences and skin folds and things of that nature. So we get you experience with that. We every year participate in the KSAN Public Policy Workshop, and if we can just get past COVID, we will get back to Topeka and actually be able to go in and talk to legislators. Right now, it has been virtual the past couple of years, but really helping us to understand the importance of public policy and getting more exposure with that. We have also other types of events that are just incorporated all throughout the year. So this one here is one of my favorites. The Beef Council sponsors this, and it's a Nutrition Communications Day. Each year it looks a little bit different on what we're focusing on. We've had, they bring in national media people and learning about if you were to do an interview, what are the do's and don'ts doing that. We actually practice and give feedback on that. Or doing an Instagram live session, and in the afternoon we always do some type of food demonstration. So be it that we're modeling what it would be like to be on a morning news show doing a cooking demonstration, or this past year is a little bit more open to you just providing. So if you were to do it on Instagram or Facebook Live or something, but you pick a theme and then really walking through and providing really great instruction as you're doing it as well. And so this is something that our students, even if you don't plan to do news media types of things, there are so many transferable skills that come from this. In the spring, as we're finishing up spring semester, we always go out and do a dairy farm tour, and you can see those cute little cows there that were born that morning. But we really learn about sustainability and how food gets from the farm to the table, and that is always a real fun event. We encourage our students to go to as many, conferences as possible. We don't require, but whenever FNC is in, close to the Kansas City area, we often have a lot of students that go and they have a great time. So again, if we can push past COVID, hopefully we'll get back in person here to be able to do that. And then something that's really important to me is just intern life. And so the students, it's so fun to see them engaging with one another, true friendships form, and long after leaving the program, these students are lifetime friends, and so do a lot of things outside of just our typical, Mondays on campus. And so some great friendships and bonds have been made there. So in June or July, depending upon how quickly that you move through the internship, you will then earn that graduate certificate, but more importantly, that verification statement that allows you to then sign up for the RD exam. And so our goal is that you're really taking that exam as close to finishing up the rotations as possible. We want those hands-on skills, experiences to be right there in the forefront, so that you can kind of think through that application. So again, that's why we've been studying the whole time. And then usually I would say students study very concentrated for maybe about 3-4 weeks and then take the exam. Typically at the end of July, early August is the most common time, but definitely if you're staying with us for that second year, hopefully by the beginning of September, so that we don't get into trying to study for that while starting the second year of classes. I am so proud of our students for their phenomenal job on the RD exam. So we have a great first-time pass rate. So if we look at the past 5 years, 96.25%, and long-standing, if we're looking at 1 year from first attempt, everyone is passing that. So, and I should also say they don't just pass, they do really well. So our scores are like in the 90th percentile, and so they are getting well above that minimum score of 25. And also, if you start the program, we do a great job of making sure that we get you through that program and finish. So I'm sure everyone at this point is frantically trying to get applications ready. And so please note that we kind of have a three-pronged system here. So you need to apply within DICAS. So those are open now and are due on February 15th. And once I see that you have an application in DICAS, then I'm going to send an email thanking you for applying, and then also asking you if you would apply to our graduate school. And so I'll provide instructions in that email on how to do that, and some of the stuff you can just say refer to DICAS. And please note that you have a little bit longer to do that. So we need to have that done by March 15th. And then please don't forget to apply to D&D Digital and to do your rankings there. So every year I have a student that I can see in DICAS, but not in D&D Digital. So no matter how much I would like to rank that student, I can't. So make sure that you are doing both of those steps there. So how we go about ranking our applications. So if you kind of think on a 100-point system, I will say that this has changed this year because we found out we actually did not have to require the GRE. So this year we are not requiring the GRE, and so we have kind of changed around our ordering system here a little bit. So 40% are going to come from academic performance. Half of that is going to be your cumulative GPA, so any classes that you've taken at any point, and that just needs to be above a 3.0. And then the other half is going to be averaged on a sliding scale from your DPD professional courses and your science courses. Excuse me. Then another 10% or 10 points is going to come from your work and volunteer experience. And so these 10 points can come from any formal work experience that you've had. And so we're looking at transferable skills. We know that sometimes, as much as you'd like to get a whole bunch of nutrition experience, sometimes your particular situation may not have allowed for that. And so if you're able to hold down a job, you know, that shows responsibility and being able to routinely come back, and communication skills and all sorts of things that are still applicable to what's going to be necessary in being successful in the internship program. And so we have a sliding scale just based on how many hours that you have had. And then the same thing we're going to have on a smaller scale that we're looking for experience with nutrition or healthcare related experiences. This can be paid or volunteer. And again, just on a sliding scale, but the top number there is going to be much lower than just for experience in general. And then another 10 points for leadership and for undergraduate research if you've had the opportunity to do that. If you haven't, that's okay. If you've had other leadership experiences either in college or outside of that within the community, then we're just looking for, you know, if you've sat on a committee and had a board position, if you've been an ambassador at your university, or maybe being some type of tutoring or GTA position, or, you know, in a work setting, being a manager or anything of that nature. We also look at merit-based awards and honors. That includes merit-based scholarships. And then we will be having a virtual interview. This is going to be very, very brief, but it's going to give us an opportunity to get to know you better, for you to ask questions of us, and then we'll have just a few kind of standard questions that we'll be asking as well. And then 10% is going to come from that personal statement. So, you know, please make sure that you're expressing why you're interested in coming to us and why you'd be a good fit. And then just make sure that you answer those standard DICAS questions as well. And then the last 5% comes from your recommendation letter. So all of that together totaled up to 100. We have a committee of individuals that goes through and very thoroughly goes through that DICAS application. And then we all do our scores. We'll have those interviews. And then we compare scores, and where there's discrepancies, come back, discuss, and ultimately change our scores or leave it where it is, and we average that. And then we just rank, order, and submit all those that we really feel are going to we feel are going to be successful should they match with our program. So again, I want to point out GRE is no longer required, and we do take 16 interns, spring only match, and we do take our students from a variety of different locations, because we don't have a DPD program here to funnel into our program at KU. So we do often have many from the Midwest, but we really have from all over. So looking at past applications, the average GPA of those that match with our program over the past 5 years, about a 3.65. Don't let that scare you. If that GPA is a little bit higher than what you have, there's a range. And maybe if your GPA is a little bit lower, maybe there's other areas, like maybe you were able to get more work experience. So please don't let that scare you from applying. We're truly looking for that well-rounded person, so it doesn't have to be that perfect 4.0 GPA. We want to see that you have, you know, some work volunteer experience. We want to see that leadership, maybe that you have some research experience. All of those things go together in determining the ranking. Over the past 5 years, our applications varied from about 34 to 55. Last year being the lowest with that 34. We didn't realize that we didn't have to have that GRE, and many other universities waived that last year. So I think that was also part of the determining factor there. So some things for you to think about also. So if you match with our program for the internship, that automatically admits you into the master's program. So no need to apply again later on. And it's you do have the option of being non-degree seeking, but we really encourage everyone to be degree seeking, because that allows you to be eligible for financial aid. It allows, if you were to change your mind down the way, it allows more hours to count towards that master's. So if you decide that you don't want to be degree seeking and later change your mind, only 6 of the hours will count towards the master's, as opposed to 14 if you were degree seeking. And it also makes you eligible for assistantship programs during the second year that really make that year much more affordable. So either waiving, doing a tuition reduction, or waiving tuition, or moving you at minimum to in-state rates. Which leads me to this lovely slide. Not my favorite slide, but here you can see the breakdown. So there's tuition and campus fees, and you pick your column if you're a Kansas resident or a non-resident. This is specific for the internship portion of the program. And then down below, these are really estimates, and these come from financial aid. So for instance, the room and board, transportation, all of those things are provided as an average for all of our programs. So this could widely vary. So when you match with the program, I tell you who else is matched to the program, and I send some information about places that other students have lived in the Kansas City area, and their kind of thoughts and everything on that. So it depends on what area of Kansas City you live, if you have people in the area that you can live with, if you have a roommate. So those costs can widely vary. We don't have a ton of book expenses, supply expenses during the internship. So likely that $600 is even a little bit high. Anywhere you go, I would say you're going to have personal expenses and transportation. That just really varies on where your placements are for your rotations compared to where you live. So for some students, for an area that they're really interested in, they may be willing to drive further for that, but maybe there's another rotation that you know you need the experience, but it isn't as important to you, so maybe you pick a location that's closer to where you live. So again, I would never, if you hadn't ranked someplace in the further out locations like Lawrence or Topeka, I would never put you there if you haven't ranked that. We do encourage participation in conferences, but that's not required. And then those three bolded ones down at the bottom, those are actual costs. So you have that application cost at the beginning of the program. We do require everybody that matches to have a background check and a drug screen. That is necessary for your rotations. And then I do require student membership in the academy as well. All right, so if I have been able to spark an interest through some of that information that I shared, I hope that you will consider applying and being a part of our class of 2022-2023. So I just want to thank you for taking some time today to hear about more of our program. And if you had questions that came up as I was talking, please don't hesitate to reach out to me. You see my contact information here. I'm happy to hop on a Zoom session or a phone call, or you can just email me your questions so that we can get those answered for you. So thank you ever so much for your time.